Welcome to the COVID-19 Guide to Improving Your Natural Immunity presentation. I'm Linnell DeRue, a health and wellness speaker. I'll provide a 6-page handout upon request at the end, the last full page being all references, single-spaced, 10-point font, citing the research I drew on for this presentation. It includes many studies, research articles, interviews of professionals, and data drawn from history and a lot more. Ben Franklin said, "An ounce of prevention is worth a pound of cure." In other words, don't wait to take your health seriously until you find out that you're seriously ill. First, I want to be clear. I'm not providing or promoting any cure. I'm not a physician. This presentation does not constitute medical advice or a substitute for that of your personal health provider. If you have any symptoms you are concerned about, please contact your doctor or health professional. Also, I'm not selling anything. I do not profit from my efforts to raise public awareness with this video. This is solely a public service effort. I found that neither the National Institute of Health nor the CDC really offer anything in the way of improving your natural immunity. So if you want to improve your bounce back rate, should you become exposed, you're in the right place. COVID-19 is spread by a virus that multiplies in the mucus in the throat. It's very small in size and can be exhaled when you breathe. That's why we can contract it in the eyes, nose, and mouth. Those are areas of mucus. Something wet would stick to something wet. That's why social distancing of 6 feet is also recommended. Now, the majority of cases will be mild. You can be asymptomatic. That means you won't show any sign of having contracted it, and you can be sick with it, but not show any symptoms. And because of that, you can easily transfer it to others. These people are sometimes, if they're walking around going about business as usual, thinking that they aren't going to cause a problem, they're referred to as super spreaders. This particular virus is 3 to 5 times more infectious than the typical flu. I had made a video a few days ago, Thursday, I think it was, and I had been just blown away at the number of people in the stores. I was under the belief that this was just another strain of flu. Actually, it's not. What we couldn't learn from China because of its lack of transparency, we are now learning from Italy. 1 to 3% of people are asymptomatic. They don't show any signs of being sick with this virus. Of those, 75% go on to develop symptoms, which show in about day 4. The number of people who now fall ill appear to double every day. The mayor where I live just did a video yesterday saying that it has arrived in Los Angeles, and the people who are found to have it are doubling every day. Health officials tell us that we need to flatten the curve. You've probably heard our president and the health officials talk about that recently. You see, if we reduce the infections as much as possible, our healthcare system will be able to handle cases much better, driving the fatality rate down. However, if we don't control this and everybody goes about business as usual, and a lot of people get sick at once, our hospitals simply can't provide enough beds or ventilators because it affects the lungs to help everybody. So should you be in need of something because you have some kind of accident, there isn't going to be one available for you. So that's why it's important for all of us to take this into consideration and to practice social distancing. Beyond washing your hands and not touching your face, wearing a mask and gloves, how can you protect yourself? What are we maybe doing that is compromising our strength of immunity? How can we stack the odds in our favor? Well, I have a list of about 18 things, I think it is. Number 1, eliminate refined sugar. Read the labels. This is because a white blood cell has to contain 50 times the concentration of vitamin C as would normally be found in the blood around it. Glucose, which is sugar in its simplest form, as found in the bloodstream, and vitamin C have a very similar chemical structure. In fact, at a blood sugar of 120, the white blood cell's ability to absorb and destroy viruses and bacteria is reduced by 75%. It can take 4 to 6 hours for the vitamin C concentration in the white blood cell to reach that optimum 50 times concentration again. That is if no other sugar is eaten. or drank. For example, something that a lot of us may not realize, a glass of white wine has 6 teaspoons of sugar in it, and this will handicap your white blood cell capacity by 25%. A can of Coke has 9 teaspoons. A tall mocha coffee with a brownie will decrease white blood cell ability by 65%. Something else to know that's very important, refined sugar also paralyzes the cilia in your esophagus. That's the little hair-like or finger projections that line our throat that move in a wave action, brushing bacteria, viruses, debris up our throat, where we can cough it out or it ends up in our nose. And it clears the throat constantly of anything that, should they quit working, will sit in place and begin to multiply. But if they're brushed away, they're not in one place long enough to do a whole lot of damage, unless we're talking about COVID-19. This is a different animal. But refined sugar will greatly increase your susceptibility to sickness because these quit working. Now, if you suck on a throat lozenger that has sugar in it, the reason it's helping you to stop coughing is because it's paralyzed the cilia. They're no longer brushing and then creating that cough reflex. That's why you quit coughing, but it also keeps you sick longer. So if you're going to use a throat lozenger, buy one that doesn't have sugar in it. Number 2, vitamin C. When I was at the grocery store, I found the shelves, many of them cleared out. In the refrigerator section, the orange juice was completely gone, just a couple bottles left. People typically think that there's a lot of vitamin C in orange juice. There is. However, your natural form of vitamin C is going to be better because it's not all slammed in at once and it's not taken with a lot of sugar. Orange juice is very high in sugar. It has no fibers, and fiber is what helps to slow down the absorption of sugar in your blood, raising your blood sugar level. That is going to be, as you learned, counterproductive. So you want to have fruit as it is in its natural form. Your best resource of vitamin C is actually from the red bell pepper. It has 190 milligrams in 1 cup of chopped red bell pepper. Orange juice, fresh squeezed, has 124. Additionally, when they make orange juice, they harvest the oranges, they juice them, they make a concentrate, and then they store it for a number of months, sometimes up to a year. I toured an orange grove in Florida a few years ago, and I learned that this is what they do. They store it as a concentrate, and then when they reconstitute it, because the vitamin C has died by that time, they add vitamin C back to it, and they add natural oil from the skin of the orange because it's lost a lot of its orange flavor. It doesn't taste the same. And that's why orange juice that's reconstituted doesn't quite taste the same as fresh orange juice that's just been squeezed. If you want your best source of vitamin C, get it straight from the plant. Vitamin C happens to be the vitamin that is most easily destroyed by heat above 70 degrees. Anytime they pasteurize something to avoid it from spoiling on the shelf, that means that it's been highly heated. So the vitamin C is lost when something is pasteurized. Your best resource of vitamin C is actually from the red bell pepper. Number 3, antioxidants. Fresh garlic, in which thiosulfonates appeared to be the active components, was virucidal to each virus tested. It means it's against viruses, it kills them. There are other antioxidant foods: kale, broccoli, Brussels sprouts, and spinach. And of the fruits, believe it or not, plums, highly antioxidant, and all of your berries. Number 4, elderberry. Elderberry extract has been found to reduce the length and severity of symptoms caused by the influenza virus. While these results are promising, further large-scale human studies are needed, and it was found that it may support the immune system. I looked online for elderberry because I'm almost out, and this is the brand that I get. I have a slide of it, and they're sold out. So a lot of people understand that this is helpful. Number 5, NAC, NAC. This is called N-acetylcysteine. This is a natural antioxidant. In randomized placebo trial test that was done, it showed that taking 2 of them, which is 1,200 milligrams, you will develop antibodies to it in a 3 out of 4 chance. This is because NAC raises glutathione levels, which is a potent antioxidant. Number 6, zinc. This is toxic to the coronavirus on contact. The National Institute of Health notes that children and the elderly with zinc deficiency in the developing world have been shown to be more vulnerable to pneumonia and other infections. Pneumonia is often how people die from the coronavirus. The zinc has found that it helps to produce and activate T cells. These are a form of white blood cells. What you can do is get zinc lozenges and suck on it lying down, if you're able to do that, and let the medicine dissolve in the back of your throat and nasopharynx. Using zinc oral spray is an alternative. I was sick with the flu for about six weeks several years ago. I just could not get well. For some reason, I have a very low white blood cell count. Physicians I've asked don't know what to suggest to improve it. And I just couldn't kick this flu bug. At the end of the 6 weeks, I remembered that my chiropractor had told me that most people are zinc deficient and that it helps your immunity. So I told my husband, would you go to the health food store and get some zinc for me? So he came back with a spray. It has a nice flavor to it. And I sprayed that in the back of my throat, and within 20 minutes, I started feeling better. And in 24 hours, I was completely well. I finally was able to kick it. It had just been at this low level of sickness, dragging on and on. So my personal experience with the zinc spray is that it definitely helps. You'll want to follow the instructions for use. And like I said, it's very pleasant tasting, and I keep it with me when I fly so that I can help my immunity when I'm on the airplane. Number 7, water. Drinking lots of water is really important. This thins out the mucus and allows the little cilia hairs on our throat to move as they should, brushing the bad germs out of our respiratory system. Now, drinking water will not cure the COVID-19. I saw a meme on Facebook that suggested that drinking water will wash it down the throat into our stomach, where the stomach acid will kill it and you'll be fine. Not true. Don't believe that. The other reason lots of water in our system is helpful is because it thins our blood, which will help to purify our system better and faster, and prevents us from becoming constipated, which is another source of elimination of toxins. Water is the grease, if you will, that runs the wheels of your body's entire system. And if you do get sick and you get congested, I have a recipe that someone gave me that helps to thin the mucus. It, in my experience, has helped me. When I was a child, my mother used to make a tea of lemon juice and honey, and I just loved it. But this is even better than that. It does use lemon juice and honey, but it has some other things in it, which is easy to make, and I'll share with the handout if you ask, just upon request. Washing your hands. The reason that this is being emphasized is because soap breaks down the virus cell wall. It begins to disintegrate, and the inside of the cells fall out and will be destroyed as this thing breaks apart. The innards will just disintegrate. Washing for 20 seconds allows this to take place. So you can't be quickie about your washing. You got to count. This means you need to include your thumbs and the back of your hands. Your whole hand should be washed. You can go up your wrist a little. Another use of water that's very helpful to fight infection is hydrotherapy. Hydrotherapy is something that creates an artificial fever. It raises the white blood cells. When I was in 9th grade, I did a research article on hydrotherapy, and my teacher thought it was so good, he asked to borrow it. He was getting a degree at the local community college, and I lent it to him, but I never got it back. I don't know what he was using it for, but he thought it was excellent. So I learned a long time ago that hydrotherapy really does work. This is a method of heating and cooling the body alternatingly with water. 2 tubs are best. They used to do this in hospitals 100 years ago, but showers are the next best thing. They're more convenient. You want to go in hot water for 3 minutes and then cool or cold water for 15 seconds, and repeat this for 3 cycles or more. I do more. Be sure and include your head, get it wet too. And before the last cycle, lather up with some Castile soap. This will help to remove the toxins that you're expelling. What you don't realize is that you're sweating with the hot water, and you're going to be expelling a lot of bad stuff. So you want to repeat this one last time to rinse off the soap and the toxins. Then go to bed. Lay down for 20 to 30 minutes between two towels because you're going to perspire a lot, and have a bowl of ice water and a couple washcloths that you can put on your forehead so you're not tempted to uncover and cool off that way. The instructions are in the handout. This helps the lymphocytes to come out and fight disease. Number 8, exercise. Exercise is very important before you get sick. Don't do this once you are sick, please. It also helps to decrease stress and get a lot of air and fresh air into your lungs. So outdoor exercise is the best. Number 9, alcohol. Alcohol is not recommended if you're sick. Alcohol is an immune suppressant. And as I suggested or mentioned earlier, that it has sugar in it. And there's plenty of research to support that. That's in the handout. Number 10, tobacco and marijuana smoking. This is going to predispose you to a lung infection. Logical, yes? Nothing more needs to be said, although research is in the handout. Number 11, meat. I am sorry to say that meat is very inflammatory. There is a link to a video in the notes that will educate you on this. The other thing that's inflammatory is high-fat food. Anything that's deep fried is going to have a lot of fat in it, a lot of oil. The other thing that's detrimental about this kind of oil is that in order for it to fry the food, it's heated to a very high temperature. That changes the nature of the oil from a cis oil configuration like this to a trans fat. And our body has keyholes, receptors that will accept the cis fat configuration, but not the trans fat. That's why you hear about trans fat. It's a toxin to the body, and the body doesn't like it, doesn't have a place for it, and it's considered cancerous from what I understand. So stay away from deep fried food, and let's move on to the next one. Number 12, sanitizer. That has been on a lot of people's tongues lately. Not the sanitizer, but the topic. Until infectious mucus has completely dried, the infectious influenza type A, in the research article I found, was shown that it can remain on the hands and fingers even after appropriate use of a ethanol-based disinfectant, the hand sanitizer. So it doesn't break down the mucus and kill the virus in it. You have to either wash your hands and then use the sanitizer if you've gotten, blown your nose and gotten snot on it or whatever, or coughed and gotten it on your hand. You want to dry your hand, then use a sanitizer, or wash your hands. Be sure and wipe down the doorknobs and the handrails if you have a second-story home, and all your light switches. And the most contaminated thing in our home is our cell phone. And the research shows that for some reason, men's cell phones are more contaminated. I don't know why. But anyways, wipe down your cell phone, your keyboard, and the mouse. Those are areas that just breed a lot of germs. The COVID-19 virus, by the way, has double the transmission rate of the regular flu. It stays on surfaces for 3 days. I know there's other information out there that may say something different. At any rate, take it for what it's worth. It stays on there more than just a few minutes. So wipe everything down every day. When my husband comes back from being out on an errand, I go around the house with a Clorox wipe and wipe all the doorknobs inside and outside of the front door, the door lock, and the handrails and everything. Number 13, sunlight. Sunlight is antiviral. It raises vitamin D levels, and it helps through serotonin to help you feel calm, because the more stressed out you are, the more the stress will suppress your immune system, and the more likely you are to get sick. Something that occurred to me this year was that I don't get sick in the summer. I was trying to think, what can I do to prevent getting the cold or flu that usually comes after Thanksgiving? And I realized, you know what? I don't get sick in the summer. I wonder if sunlight has something to do with it, or vitamin D. So I did some research. Sure enough, vitamin D. So I asked my doctor about it, and she recommended this particular product that's in liquid form Vitamin D has to be taken with some kind of fat for it to be absorbed. So this tincture is, or this bottle is made with peppermint oil. So it tastes very pleasant, and you just need 2 or 3 drops, and the oil is already with it. So it's easy to use. And guess what? My next blood test I got, my white blood cell count was up. So that's a good thing. For me, it seemed to be effective. The other thing they found was that SARS, which is a form of the coronavirus, decreased in incidence as the cold temperatures warmed. Number 14, fresh air. History demonstrated that fresh air improved recovery in cases of the Spanish flu in 1918. The people who were sick were moved outside because they had so many people that needed beds. They put them into tents. And when it was a nice sunny day out, they moved them outside. And it seemed from, if the report that is correct, that was recorded, it reduced deaths among hospital patients from 40% to 13%. If you're sick and you are confined to a bedroom with the coronavirus, COVID-19, then every couple days, move the person who's sick into another room that's prepared and air out the room that they have been in by opening the windows and the curtains, air it out with fresh air, and then move them back in. After warming up the room. You don't want them to get chilled. Number 15, wearing a surgical mask. Surgical masks do help. Studies show that 63% of the virus is prevented from being breathed in, but the surgical mask isn't fail-safe. It doesn't stop droplets, and it will stop all but the fine particles and very small viruses. The coronavirus is very small, and they're not tight-fitting. If you're not sick, it doesn't stop you from getting sick. There are various levels of masks filtering various sizes of particles, and I have a study in the handout that shows the different masks and what they are, how effective they are. Number 16, nitric oxide. This inhibits the replication of the coronavirus. This is not nitrous oxide. Nitrous oxide is what we use in the dental office, and that's also known as laughing gas. This is different. Nitric oxide enlarges your blood vessels, and you can find it in natural sources, plant sources, beets being the highest, beetroot, garlic, all of your greens, kale, arugula, spinach, cabbage, celery, cress, chervil, lettuce, spirulina, and Swiss chard. And then there are also fruits, citrus, pomegranates, nuts, especially walnuts, and seeds, watermelon, and grapes, red grapes. The skin of red grapes is very antioxidant and high in nitrate. Number 17, another item that's really important is to get your rest. Adequate sleep, particularly getting sleep before midnight, is really super important. Those are the hours that your major organs do their repair. So at the first symptom, go to bed and then stay there at least 2 days after you feel well so that you do not relapse. You need to monitor your temperature, because without rest, everything else you do will not work. And once you relapse, it's very hard to recover again. This is where people typically don't make it, is if they have a relapse. So you want to make sure that you get your rest. Number 18, social distancing. We've heard a lot about that. Wisely limit your business as usual contact with others. It's important to keep in mind that we can't stop this virus. We're just hopeful that we can slow it down so it doesn't collapse our healthcare system. This is my specialty. Oral hygiene. Keeping your gums and teeth healthy is paramount to reducing overall inflammation. Did you know that 75 to 80% of the population has gum disease? Chronic gum disease, chronic inflammation in your mouth, will make your whole blood infected with this oral bacteria, making it fight off something that it doesn't necessarily have to do. The cleaner you can keep the gums around the neck of the tooth clean, the healthier you will be, and the better condition you'll be in to fight any kind of infection. And what's interesting is most people brush the same way they were shown when they were 3 or 4 years old. They carry that into adulthood. Then they come in and see the dental professional and told, you need to brush your teeth. And they're like, I do brush my teeth. That's because it's how you do it. I have found in doing clinical hygiene for 36 years that a lot of people are making the same mistakes, and these minor improvements that I show them, I have a smile system for brushing. It's a 5-step method. Will clean these up right away. And within a day, the gums stop bleeding and their gums are in much better health over a period of time, as usually 6 to 8 weeks, things will start to heal up very, very nicely and we get some good resolution. But it's all a matter of how you do it, not whether or not you're doing it. We know you're doing it. Well, most people do it. So you want to get your gums and teeth in really good shape. You can go to my website, brushforlife.com, and it leads you through the steps to transform your brushing and flossing to that of a dental expert. Also, you want to look at the FAQ page. It's got a lot of very valuable information. I have pretty much the same questions all the time asked to me, and I suggest you be sure and spend time on looking at those FAQ sections as well. In the checklist that I've prepared, for those who like to geek out and read about COVID-19, if you're not already burnt out on it, I include the link to an excellent study published March 12 this year, just last week, in the Sage Journals of Dental Research. I was pleased to see it was written almost entirely in language the average adult can understand, and you'll find answers to most of the questions that most of us have. There is an abundance of information out there. I've included links to it in my notes for you. To get your handout, all you have to do is go to covid19.brushforlife.com. I hope this video was helpful. Give me a thumbs up if it was. Even better, write a review for me on Google. And if you would subscribe, it would really be helpful. If you want me to speak for your corporation, you can find me on LinkedIn or through my contact information at the bottom of my Brush for Life website. If China is any indicator, this isn't going to last more than a few months. So although your gatherings of 10 to 50 people isn't happening right now, booking your company or organization now for 5 to 6 months down the road would be a good idea. Thanks for watching. I'm Linnell DeRue with Brush for Life.